Hello and welcome back to Flipped Psychology. I'm Miss Lee, and this is the unit Psychological Disorders. We're in section 2, and in this video, we're going to be covering the anxiety disorders and the families of disorders that include obsessive-compulsive disorder and post-traumatic stress disorder. Our objective is to analyze the impact of psychological disorders on the individual, family, and society. If you haven't done so already, go ahead and grab your notes and let's get started. So let's get started with anxiety disorders. First of all, this is a group of conditions where the primary symptom is either anxiety or some type of behavior that acts as a defense against anxiety. People who have anxiety fear that something awful will happen to them, and they're almost always in a state of intense apprehension, uneasiness, uncertainty, or fear. There are several types of anxiety disorders. We're going to talk about generalized anxiety disorder, phobias, including a couple of specific phobias, and panic disorder. Okay, so let's get started with generalized anxiety disorder, or GAD. This is an anxiety disorder whereby a person is continuously tense. They're almost always apprehensive, in a state of autonomic nervous system arousal. We talked about that in previous videos. So they're always on high alert. Their body is almost always on high alert. They're constantly tense and worried. They feel inadequate, they may be oversensitive, they may have trouble concentrating, and very often they suffer from insomnia. In generalized anxiety disorder, the person is almost always unable to either identify or avoid the cause of certain feelings. Phobias are characterized by a persistent and irrational fear of an object or a situation that disrupts behavior. So the fear is one thing, but the behavior is disrupted, so it's causing some type of a behavioral change in the person. And the person can experience sudden episodes of intense dread related to specific things. So on your screen, you see some examples of different specific phobias that people experience, like being alone, storms, water, close spaces, flying, blood, heights, and animals. On this slide, there are some of the most common types of phobias, but at this point, psychiatrists and psychologists have labeled over 700 specific fears, and they estimate there are thousands more. Basically, if the thing exists, you can be sure that someone has some type of a specific phobia about it. When such fears are persistent and debilitating, they're considered phobias. And again, you see a number of them on your screen right now, but this is just the tip of the iceberg. Social phobia is more common than the other specific phobias, and so it is kind of put in a space by itself. This is a phobia that produces fear in social situations. People have intense fear of speaking in public, and they have a hard time doing things like going to the grocery store, going to the restroom in public, or eating in front of others. So as you can imagine, this is quite debilitating. Another condition that is so common that it is kind of pulled aside from other specific phobias is agoraphobia. This is the fear of situations that the person sees as hard to escape from. So they have a fear of leaving their own home or sometimes even their own room in a house. Very debilitating. Within anxiety disorders, you also have panic disorder. This is a type of disorder marked by minutes-long episodes of intense dread where a person is experiencing terror and accompanying chest pain, maybe, feelings of choking, and other frightening sensations. So there is a very distinct beginning and end to the episode. Okay, so this brings us to the next category, the next family of disorders. We have obsessive-compulsive disorder and related disorders. All of these have something in common, and basically that's that the individual feels compelled to perform in response to either obsessions or according to rules that have to be followed according to the person very rigidly without any type of flexibility. And you see on your screen a couple of different examples of those types of disorders. We have obsessive-compulsive disorder, hoarding disorder, body dysmorphic disorder, and trichotillomania. Hoarding is pretty well known at this point. The media has sensationalized hoarding disorder. Body dysmorphic disorder is basically that you do not see your body as other people see it. It's not based in reality. And then trichotillomania is a condition where the person pulls out their own hair. So they compulsively pull out hair that is on their own head, regardless of the pain that it causes. We're going to talk specifically about obsessive-compulsive disorder. This is the persistent unwanted thoughts, which are obsessions, that cause someone to feel the need to engage in particular actions, which are the compulsions. So don't get those two confused. Obsessions and compulsions are very different. So the obsession about dirt and germs can lead to compulsive hand washing. Those are very different. You can have obsessions without behaviors that accompany it. So on your screen, you see some different thoughts and behaviors and the percentage of people reporting those symptoms. So you have obsessions, for example, with dirt, germs, toxins, and then you have excessive hand washing, bathing, toothbrushing, or grooming. You also have obsessions about something terrible happening, symmetry, order, or exactness, and then those other compulsive behaviors like repeating rituals. And it's in order to, in that person's mind, ward off something terrible happening. So if they lock and unlock their door, if they turn their light off and on a certain amount of times, if they go back and check to see that the oven is turned off multiple times, they are avoiding that terrible thing that they are obsessing about from happening. And then the last one, the thought and behavior of symmetry, order, and exactness. This would be going over your homework a million times, checking the appliances a million times, continuing to rearrange very compulsively where it is disrupting your life. This is obsessive-compulsive disorder. Okay, then we have the next family of disorders. You have trauma and stressor-related disorders. This is characterized by an exposure to a traumatic or stressful event, and it is a specific diagnostic criterion. So the exposure or stressful event has to happen in order for these diagnoses to be made. So the first one that we're going to talk about very briefly is adjustment disorder. This is where a person is responding to that event or that situation with symptoms including low mood, sadness, worry, anxiety, insomnia, poor concentration, loss of self-esteem, hopelessness, feeling trapped, having no good options, or feeling isolated or cut off from others. They're basically having a hard time adjusting to that life change, that event or situation in a way that is disruptive. A more debilitating type of disorder in this family is post-traumatic stress disorder. It's also called PTSD. And this is following a person's involvement in or observation of an extremely stressful event. And it usually has to be occurring for at least a month or more, and the symptoms can include haunting memories or flashbacks, nightmares, social withdrawal, jumpy anxiety, not just anxiety, but feeling jumpy a lot, and also sleep problems. What's interesting about PTSD is that the person doesn't have to be directly involved or even present in the situation. Just knowing about it, knowing that it happened, can elicit responses that are post-traumatic stress disorder. When you're talking about resilience to PTSD, about 10% of women and about 20% of men react to traumatic situations in a way that develops into PTSD. But interestingly enough, Holocaust survivors show remarkable resilience against traumatic situations. There's been a number of hypotheses floated around about why that could be, but just know that different situations do contribute to the response of PTSD. All major religions of the world suggest that surviving a trauma leads to growth in an individual. So before we end, let's review what we've talked about. We talked about the impact of the psychological disorders, specifically the anxiety disorders, and the families of disorders that include obsessive-compulsive disorder and post-traumatic stress disorder. In our next video, we will be discussing depression and bipolar disorder. I can't wait to see you then. Bye for now.